Good morning everyone, my name is Hoin, and today I will talk to you about a case study related to drug overdose. Paracetamol is also known as acetaminophen. It is a non-opioid analgesic and an antipyretic agent. Paracetamol is available in multiple formulas, in solid dosage forms such as tablets and capsules, liquid dosage forms such as solution and suspension, and a semi-solid dosage form as a suppository. Paracetamol is available over the counter and on prescriptions. It is most commonly used for pain management, fever, osteoarthritis, and rheumatoid arthritis conditions. The recommended daily maximum dose is 4,000 mg. Paracetamol has high bioavailability, with almost 80% of the drug being absorbed when taken orally. Normally, the half-life of paracetamol is roughly 2 to 3 hours. At therapeutic levels, approximately 90% of paracetamol is broken down into non-toxic metabolites through sulfidation and glucuronidation pathways, and then renally excreted. However, at overdose levels, these pathways become saturated, which results in large amount of paracetamol being converted into a toxic metabolite, NAPQI. NAPQI is subsequently excreted after glutathione conjugation, which converts into non-toxic metabolites as shown in Figure 1. But as a result, glutathione peroxidase activity is reduced by 60%, and this reduction will lead to decreased excretion of reactive oxygen species and peroxynitrate, which can cause breakdown of DNA and cell membranes and the induction of apoptosis, eventually resulting in cell deaths. So here is a case study. Our patient is 26 years old male. He was presented to the hospital with symptoms such as vomiting, abdominal pain, and confusion. The patient has a history of flu and has taken non-prescription products to treat fever and aches, which include a few bottles of acetaminophen. So the doctor has ordered some blood tests. The laboratory results have shown elevated bilirubin, meaning the liver is not functioning properly to break down bilirubin. Next, we can observe there is a significant derangement in the liver enzyme ALT, meaning there are some damages to the liver cells. A high INR in an unauthorized patient also suggests poor liver function as blood clotting proteins are made in the liver. Lastly, a high creatinine suggests acute kidney injury, which is consistent with drug poisoning, as paracetamol can accumulate over time, causing nephron toxicity and tubular damage in overdose settings. Therefore, it is suspected that the patient has a drug-induced liver injury and acute kidney injury from paracetamol overdose. The standard treatment option for paracetamol overdose is administering an NAC therapy intravenously. NAC acts by restoring glutathione levels in the body, which promotes intracellular metabolism and removal of the toxic metabolite NAPQI. Most benefits were observed in patients if the treatment was initiated within the first 8 hours from the time of paracetamol overdose, but also the mortality was recorded to be significantly decreased even if NAC therapy was administered up to 36 hours after the toxic ingestion. In case of liver failure and signs of progressive organ dysfunction, a possible liver transplantation could be referred, as acute liver failure from paracetamol toxicity has a high mortality rate of 30% if there is no liver transplantation available. Patients have good clinical outcomes with a 5 years survival rate of over 70% after successful transplantation. So here is what we know. Paracetamol can lead to liver injuries, and there are multiple factors that can contribute to increased paracetamol toxicity as shown in Figure 2 below. Paracetamol overdose can lead to acute liver failure and irreversible liver injury that requires liver transplantation. Our patient from the case study was admitted to ICU with acute liver injury and was immediately treated with NAC therapy. His ALT and INR started to decline on day 3. The NAC therapy was stopped on day 5, and the patient was transferred out of the ICU for recovery on day 7. In conclusion, the case study has shown that drug-induced liver injury from paracetamol overdose can have poor consequences that lead to hospitalization and possible organ transplantation. Treatment with NAC is available to improve the outcomes of patients with major paracetamol overdose. As for pharmacists, it is important to have clinical vigilance when handling and dispensing pain medications, especially with elderly patients, because paracetamol can come in many different formulations as mentioned earlier. It can be a strong paracetamol palatine pain reliever. It can be Panadol Osteo for arthritis, or patients could have taken some general paracetamol Panadol from the supermarket to treat a fever or headaches recently. Therefore, it is important to note or even ask if they are taking any other pain relief medications at the dispensary desk. This is the end of the case study, and you can find the full details from this reference. Thank you for your attention.